Good evening, everybody. I would like to thank the Walter Bushnell Healthcare Foundation and especially Mrs. Sushma Ballia, Nishan Ballia, Aditya Ballia, and Neha Ballia. They are our like family to us, coming up many times, and of course, all of you for coming here in this wonderful evening. And of course, thank all of you for helping me to achieve. I've already achieved whatever I could as trustee of FIGO for the Asian region, and this year Foxy has selected me to go for the president's post. We don't know what will happen, but God willing. So uh, this is the FIGO office in London, which has the 135 countries, and you can see that on top right hand is BN Purandare, who was one of the earliest FIGO presidents. So it was really a privilege for me to attend. And this is our FIGO president, Dr. Ann Kihara, on the left hand side. She's from Kenya, and the five trustees of FIGO. There are five regions: Blami, Ernesto from Mexico, Blami from Africa, Chiara from Italy, Nestor from Argentina, and myself, who are in FIGO at present doing the regional trustee work. Coming to Femtech, digital health technologies can revolutionize patient care and improve outcomes. It can help healthcare providers deliver more personalized and effective care. If you look at applications of Femtech, you have digital marketing, you can do counseling by telemedicine, we have services to connect patients to doctors, we have various apps that are available. Menstrual app is there, fertility predictor app. There's a very famous app now called IVF predictor, which is used very commonly by all of us. Ovulation and pregnancy tracking apps are there. You have wearable devices to monitor temperature, respiration, heart rate, fetal heart rate. You have EMR, electronic medical records, cervical examination and screening. You can have 3D and 4D ultrasound imaging using a lot of femtech applications. Surgery can be done by big data analysis. You have menopause testing, fertility testing. You can diagnose anxiety and depression, contraception and pregnancy care. And then one of the last important components of femtech is artificial intelligence. Can be in four areas at present, which is very significant: IVF, antenatal care and labor, oncology, and genetics. So, if you look at artificial intelligence, human intelligence has two components. One is the general intelligence, which is standard AI, that is cognitive learning and problem solving. And then we have the biological intelligence, which is consciousness and emotions. So, machines with AI do not possess the natural intelligence displayed by humans and animals, which involves consciousness and emotionality. In 2018, futurist Martin Ford asked 23 leading experts, when will AI achieve artificial general intelligence? That is, when will machines start to cry? And the average answer was 2019. And at that point in time in 18, but with the so much rapid, especially with NVIDIA chip that came into the market, it is really revolutionizing very fast. AI was coined by John McCarthy and Marvin Minsky in 1956 in Dartmouth, and it came into public focus in 1997 when Gary Kasparov was defeated by IBM's Deep Blue computer in chess using some kind of AI. So there are 8 applications of AI: automated reasoning, knowledge representation, automated planning, machine ability, natural language processing, machine perception. Machine can have vision, touch, olfaction, hearing, and of course the final important thing of focus, that is machine learning, which is the study of computer algorithms that improve automatically through experience. So if you look at this diagram, there machine learning is a form of AI in which a machine can learn and adapt to suitable situations and data training. So there are two types of way in the which the machine learns. One is supervised learning. The classes of labels are known during training. So if you have an elephant, you can just show it to the machine and say this is an elephant. So that's a direct. And then the second is the unsupervised learning, such as hierarchical clustering, which is used to discover structures within data, such as the existence of class. So you can break up the elephant into multiple contours, strung, size, etc., and then the machine can conclude that it is an elephant. So it keeps on evolving itself and keep on learning. There are several machine learning techniques that can be used to learn how to map objects, to classes and create predictive models. And these are the 5 important techniques of logistic regression: random forest, naive Bayes classifier, support vector mechanisms, and artificial neural networks, which are the most important part of machine learning which we use in medicine at present. So what is an artificial neural network? It's actually not, it's a neuron network, but it's not actual neuron, it's a virtual neuron. And these neurons are made up of artificial neurons that mimic human brain. A neural network typically consists of several layers of artificial neurons fully connected to each other by edges, each one associated with a weight. Each neuron receives signals from multiple neurons in the previous layer, integrates those signals, and fires if the integrated signals are above a specific threshold. As the layer of neurons goes on increasing in intensity, then we call it deep or convoluted neural network, CNN. And there are a lot of programs that are now available to access these neural networks, such as TensorFlow from Google and PyTorch from Facebook. So now coming to our clinical language. So what is the application? In medical administration, you can do EMR, you can minimize patient stress and increase clinical efficiencies. You can have uniform work distribution. There's a paper that has come from US. So in a unit with a lot of IVF going on, some days they were having 20 IVFs and some days they were having no IVF. So automatically the AI balanced out the unit's workflow, so that can be done. You can do stock taking and inventory. Expiry, you suddenly anesthetist picks up a drug, or this is so expired, adrenaline is expired. Automatic signaling will come that in your inventory there is expiry drugs and you can remove them from your inventory. Quality control, quality assurance, and of course big data analysis, Cochrane reviews, etc., all will go away. Automatic analysis can come and you can put out a lot of data and a lot of research papers. So what are the clinical applications in AI? They are in cervical and ovarian cancer, in obstetrics, in infertility, and in precision medicine. So for AI to work, we need a data input. We are not talking about there is a huge application everywhere, but we are now talking about focused clinical application. So data input. So we need images, videos of uterus, adnexa, using ultrasound, MRI, CT scan, colposcopy. You need images or videos of sperms, oocytes, embryos, cervical cells for doing pap smear analysis. Stored images. So there's a big human image net bank where 14 million images. A lot of people, they don't look at life as a business. They look at life as a journey and they keep on uploading lot of images free of charge, and that is called ImageNet. You can go to the ImageNet and pull out whatever images you want and use it in your research work or application. You can do CTG, umbilical cord, blood gases, contractions, partogram, hormone, tumor markers, temperature. All these are data that you input into the AI, and the machine learning using supervised and unsupervised learning will evolve the program. And of course, you do genetic studies, NGS analysis, next gen sequencing of patient DNA, HPV virus, and of course, use big data for analysis. So if you look at cervical cancer, you can use it AI for early detection, staging, early accurate treatment, and 5-year survival. There are a lot of papers in now literature where AI using colposcopy imaging, the accuracy of detecting lesions and performing biopsies is very high. Or you have AI for NGS results for HPV testing, which can predict development of CIN2 with more than 81% accuracy. Just imagine if you have a lot of pap smears, if your human is made to do more than 40 pap smears a day, he'll leave the job. The machine will replace the human. Machine can analyze pap smears and have a consistent analysis of the pap smear. So that machine can, using AI, can replace it. You can use AI for ovarian cancer prediction also, 5-year survival rate using multiple parameters. A lot of analysis in the oncology areas have been done using AI. In obstetrics, prenatal scanning and diagnosis, which can, you can have improvement in images. Narendra Malhotra is setting ultrasound imaging. Improvement is very dynamic with AI. A lot of AI has been in the new machines that have come. Sonovac AC, for example, just do the quick follicles and you can have calculation without actually measuring the follicles. Risk prediction, antenatal prediction of diabetes, PH, and early personalized intervention. Decision support. AI support can help healthcare workers make more informed decisions regarding medications and interventions in antenatal care. In ultrasound, you can do probe guidance, image optimization, biometry, plane finder, anomaly scan completeness, full fetal echo, and placental volume quantification. In Intrapartum obstetrics, enhanced electronic fetal heart rate monitoring, ECG, CTG interpretation. You can help identify early signs of fetal distress and reduce false alarm. Use it for labor management and progress. A lot of, when I was president of the federation, I got a call from US. They have a they have a probe. You just put the probe on the finger and you just do the per vaginal examination. Automatic analysis goes back, and using the cervical dilatation, they can give you prediction of the birth of the and the whole partogram delivery, etc. So fantastic new analysis systems are coming in. Read and analyze text, notes, drugs using natural language processing. You can do this for early diagnosis. This is a very big, there's an app which is available. You can early diagnose preterm birth. It's very important. If you know who is going to go into preterm birth, you can put them on under supervision, antenatal care, and prevent that preterm birth from happening. Again, another big baby, in our maternal health area is optimizing cesarean section rate. So machine will in future predict whether you want to go for a vaginal delivery or section rate, and that can help you also. It can protect you. If the machine says that you go for cesarean, you go for cesarean. So it can protect you from medical legal problems. Yeah, there's Wong et al. Has shown in 2020, 2022, 87% accuracy in predicting vaginal birth by using machine learning analysis of two cervical examinations 4 hours apart, and they brought the cesarean section rate down to 23%. Fernandez showed 90% accuracy in predicting mode of delivery using AI, machine learning analysis of 48 attributes and 48 parameters. What about reproductive medicine? Actually, this is a presentation which yesterday only I just went to a fantastic new site. It's called IVF Predictor. You just go to the site, it's free of charge. There are 9 parameters. The machine asks you the question, you just go on entering, and they give you prediction of pregnancy rate. It's a fantastic program from United States, free to everyone. And because you can counsel the patient, you can say, "Hello, listen, this is your chance of pregnancy. 20%, 25%. So that is the way AI will work in the future. Ovulation prediction. This, especially during the COVID time, I got a call from Israel. So they have done in Sheba Medical Center 50,000 analysis. He was telling me, Dr. Pai, if you use our AI system, your pregnancy rate following frozen transfer will go up by 10%. You just need to pay us $50 per. Actually, I was about to do it, and then COVID. So there are a lot of these systems that are coming in. Another potential application in the infertility workup is the evaluation of the endometrium and the contours of the uterus, and automatic assessment of AFC, follicular tracking, gonadotropin dose calculation is already there. The person is there who's chasing me from United States. She has a program where you can predict the dose of the gonadotropin with accuracy. Means you don't need your assistants to do the stimulation at all. This just by the machine. It can, and automatic endometrial receptive analysis. Lot of programs are coming up. Just by sweeping it, you can say when to do it. Coming to oocytes. So this is the oocyte imaging system on the right hand side, which we use since 5 years now. I'm using it. It's called Violet. This is the system which is from Canada. So when we are doing the freezing of oocytes, after the oocytes are removed, we dissect them, we take the photograph, and we export the images to the server in Canada. And within 2 minutes, it tells you exactly what is the chance of these eggs giving rise to a pregnancy 10 years down the line when you thaw them. Suppose the Violet gives a bad report, we can counsel patient to go for one more cycle of retrieval. All our patients last 4 years, we offer them Violet. And there's another program called Magenta. So this program is for IVF patients. So if they're a poor responder patient, normally they will get 1 or 2 oocytes. Now these oocytes are poor quality oocytes. But you can't tell that. You will say, okay, the oocytes are not that great looking. But is there a way to tell them objectively that the oocytes are not great looking? That's called Magenta program. So the AI tells you whether this oocyte, what is the chance of it becoming a embryo, and then you can counsel the patient showing the report. Suppose the eggs don't fertilize, because many of these poor responders, they fail to fertilize. Then you can counsel the patient and say, listen, Magenta said that it's not me alone. The machine also analyzed your oocyte quality and told that your eggs were not good. And that's why the fertilization failed. You can counsel them to then go for egg donation, okay, or what we do for these patients. So this is how we do the tool image analysis and export, and the machine send the, on the right hand side, the machine is showing you the probability of fertilization. It's a fantastic tool. I can't imagine with life without magenta and violet at present. They are totally dependent on them. It can also identify embryos which will result in successful pregnancy. So we there are different techniques. So if you have the whole IVF story is about, if there are too many embryos that are there, four blastocysts are there, which is the one right one to put in pack and get the best chance of pregnancy. Of course, the ideal test is pre-implantation genetic testing with trophectoderm biopsy and analysis. But now non-invasive testing has come, and now the static imaging has also come. So this is what is known as ERICA. So during the COVID times, I talked to Badiola, who is a fantastic guy who does AI in Mexico, and he's created this system called ERICA, Embryo Ranking Intelligent Classification Algorithm. So you just, if there are four blastocysts, you take the photo of these four blastocysts, you export them to the server in Mexico. Within 2 minutes, they rank the AI ranks the embryos. So now you say, Dr. Pai, this is just a photograph. How do you? There are 40,000 parameters that the AI is assessing as the photo is analyzed by the server in Mexico, and then it predicts the. So another tool which we use a lot in the lab is the embryoscope. So in embryoscope, this is a machine where you do time-lapse photography. So every 15 minutes, the video is run, and you take the photo of the embryos as they are cleaving in the incubator. And this company bought the company, AI company in Australia, and they came out with a new IDA score. So when the machine gives a score of 5 out of 5 or 4 out of 5, we get a pregnancy. It's so accurate, I can't tell you. So this they just do the analysis, and the videos are interpreted, and they've already done interpretation based on 150,000 video inputs. So see, as the machine gets on improving better and better, the predictions will become better. So male infertility also, there's a lot of application for AI. I don't want to go into it because the time is short, but one of the base things that you can have is the SID. So SID is going to be a game changer. So as you are doing the injection, micro injection, you connect to the server. Again, Badiola has created this, and the server is seeing the sperm, and it grades the sperm as it is, as you're doing the ICSI, and it tells you which sperm to pick up and inject to get the best chance of pregnancy. This SID, actually, as when after go back, I'm going to start paying them money, because it's all money payment. They have technology, you pay the money, buy the technology, use it in your lab, and try to give your patient a better result. What is personalized medicine? That is individualization of disease management. So in the future, you go to a general practitioner, he will take your data, including your NGS. So every one of us will have a DNA profile on the chip. He'll just input it, and based on the NGS and multiple other parameters, using an AI system, he'll be able to predict which drug is the right drug for you to be given. What are the interactions? So all those things the machine will calculate. So what is the future of AI? Open. So what is OpenAI? So the Chat GPT is a generative pre-trained transformer. It's an AI chatbot, and it can do almost all things that humans do: language, conversation, email, blogs, text, office work, research, programming, translation, continuous client support. And this is going to be the future. So coming to the last 2-3 slides, as what are the advantages of AI? As good or better in diagnosing breast cancer, melanoma. In skin, they are going to crack it. AI language translation can even deliver in native language. So many of our Indians, suppose they go to Italy tomorrow, you have the translator. As you are talking, the language will get translated. And if a patient in Italy is talking in Italian language, it will get translated to Hindi or whatever. So the AI can use as an active translator. So a lot of people can go and work in countries where the language, they don't know the language. Using a AI interaction can improve customer satisfaction through content, messaging, ads, and recommendation. Great in data heavy industries such as pharma, banking, insurance to reduce time for analysis and fraud detection. Saves labor by automation and increased production. AI virtual agents are always available. They don't sleep, they don't eat, they don't go to the restrooms, etc. What are the disadvantages? Deep fakes, multiple platforms are there. There's a lack of standardization. Data bias is there. Small number of data. Ethnic variability is there. A data set based on Canada may not necessarily be B, but now last 4 years they have taken a lot of data from me. The Canadian machine is learned from my data and he can be applied to the Indian data as well. And of course, there are a lot of solutions which I'll know. The dangers of AI. These are the last few slides. Stephen Hawking said AI will spell the end of humans. Once humans develop artificial intelligence, AI will take off on its own and redesign itself at an ever increasing rate. Humans who are limited by slow biological evolution will be unable to compete and would be superseded by the machine. But you can't put a barrier to technology. Can you look at our technology? In the olden days, we had cars, then we went to trains, planes, space shuttle. Maybe we'll do time travel also. Similarly, in our obstetrics, we did vaginal delivery, then we did forceps, cesarean, CTG, and then we may do exogenesis. We may have baby totally formed out of the body, or we may have vaginal surgery, laparotomy, laparoscopy, robotic surgery, and maybe voice controlled robotic surgery. So you can't block technology. And of course, Mark Zuckerberg and many of the CEOs say that AI can be controlled. And recently there was a meeting for controlling AI. It's like nuclear energy. You have to control it. You can't say that we will not have nuclear energy. You have to control the nuclear energy. Similarly, you have to stay in control of the AI. In conclusion, over the last 3 to 5 years, we have witnessed the increasing utility and exciting applications of artificial intelligence in OBGYN, especially in obstetrics, cancer, and reproductive medicine. Artificial intelligence will usher in a new era of standardization, automatization, and precision, leading to personalized medicine. Artificial intelligence driven approaches are more likely to be more objective, rapid, and most importantly, more accurate. Wider use of AI in precisely assessing patient characteristics such as ovarian reserve, age, endocrine status, clinical diagnostic stats will undoubtedly increase the efficacy and efficiency of diagnosis and treatments of all reproductive disorders. And what is the future? There's a combination of AI and human that is called super intelligence. So if you see this man, he's a paraplegic. There's a chip implant in the brain, and there are electrodes that have been implanted in his forearm muscles. So by just thought and using the chip, he's been able to move his hands and all that. So the AI, but it could not have been possible unless the NVIDIA chips were there. You need rapid computing, very fast acceleration of the computing system, and this is going to be the future. The future of mankind is in the integration of the atom, the gene, the byte, and the space. Thank you. Very well said.
I think Dr. Pai did an absolutely fantastic job covering the clinical aspects in Obs and Gynae, and it's wonderful to see how much you're using in your own lab. So it's not just a theoretical lecture about it, but you're sharing your own experience. I won't cover much more in AI, but I thought I'd give you a couple of insights from our research at the Vijay Institute. I will be speaking about for 5 minutes to get your involvement and help as well. So I think the last 2 years I've trained maybe 8,500 CEOs and leaders, 150 workshops across the world, and that's been a bit of my life. For those of you who are concerned, I'm still married. It's been on. Here's a couple of insights which I thought I would add. So Dr. Pai talked about the clinical. I do want to mention for a bit the administrative and the productive benefits that we all can get from AI, whether it is how we run our hospitals, our clinics, both managing liability, but also huge opportunity in the way we interact with parents, quality of care, and all of that. But then also as individual providers, our own productivity, the quality of care we give, but then how much can we get done? All of us struggle between actual clinics, research, learning, and a whole bunch of other time commitments in our lives. So I have some very good news for some of you. So after a lot of transformations we've done, and I'll talk more about healthcare, it turns out for the new AI post 2022, the transformative and diffusion models, the older you are, the better you are at AI. And this is something we've realized, which is very interesting thing that came out of this. The companies we've transformed, including healthcare, people who are 40, 50 years and above, usually within 3 months are able to get 10x to 20x productivity. Between the ages of 25 to 40, 45, 3x to 5x. Under 25, that productivity almost drops to only 40% increase. And so for all of you here, particularly those who are 45, 50 plus, I highly encourage you to jump into this as soon as possible. Learn, get trained, and I'll talk about some things you can do, because you will get 10x, 20x compared to the young people. If you leave this new technology to the young people, they will only get 40%. So please don't outsource it to them, do it yourself. And I'll leave it on that end.
Thank you, Rishikesh. I think it was a really fascinating talk. And Aditya, I was remembering your last talk in the last IOG.
And I'll do a quick
it was, it's an eye opener, and it's absolutely something which I'm feeling that it's going to bring a pronounced change in how we are actually practicing and in our journey towards patient care. So what I understand today, we are going to become much more efficient. We are going to, make much less errors. But, and of course, the patient's journey is definitely going to be an improved one when we are using AI. But it's not as simple as said. It needs a lot of training. First of all, I think we all need to be ready to accept it, adopt it, get trained, as Aditya was telling. And maybe the training for our young doctors is also going to be absolutely different. And what is important here is that it is still a black box. It is still, there are lots of things which we don't really understand. But today, from the talk which I have heard, I'm just thinking that tomorrow I'm going to be like a super intelligent human being who will be fully efficient and will be able to do everything, in a few seconds. And of course, we need to be very, very careful on how we integrate this, because when we understand, even Modi ji is talking about it, the deep fake, I mean, the misuse of artificial intelligence is something which is very worrisome. And I would say that science and scientists will do whatever can be done, but it is for us societies and the governments to decide what should really be done.
Funny part is that lot of my work is done by my CEO Ojaswini. So I was telling once, I was just recently, I wrote something. I said, "Will you refine it?" So she said, "I'll put it in AI." So she did it. She refined. I said, "This language is too AI." She said, "Sir, there is another AI available that can make it sound human."
Exactly.
So she again put it back and refined it, so the AI made it sound more human. So that is and the other point I would like to say is that you must have the ability to override.
Yes.
That is the ability that humans have got. So we have to retain that ability. We need to retain the veto right. We should not depend totally on the machine. Many times, if you say, I always say, type, who is the president of Foxy? Every time it comes with the wrong information.
Yeah.
Many times. So the machine, for information purpose, I feel it is not a good information. For language processing and interaction and all lateral thing it is, but information, because all the time information. So I think Google is still the best way to humanly go and pull out the information and then interpret it and analyze it and make it and conclude on it yourself. You should not allow that to go to the machine. So routine mundane things you can allow the machine to do. But one of the important things I'm going to do is replace the secretaries. But that is the one thing, it's very irritating. They don't never take the phone. But yes, they will come when you are in crisis in the night, they may come and help you, which the machine will not.
I know. I think the humans cannot be really replaced, because the empathy and the other emotions which they normally have, no machine is going to have.
Yeah, good evening. At the outset, thanks to Mr. Barlia and family for giving us this opportunity to be here. And coming to AI, we have heard last year from Mr. Aditya Barlia about the AI, and he has given us some demonstration also. And see, in 1 year, lot many things have evolved and changed. And now in our practice, AI is playing a major role in the background. And as Dr. Pai has highlighted its role in every type of subdivision of obstetrics and gynecology, starting from preconception, fertility, even genetics and pregnancy, fetal monitoring, ultrasound, everything. But we have to understand their pros and cons also. That is very important. And that you all must be aware about the debate which is going also, whether AI is really needed or should not be used. But as a whole, what is there is that artificial intelligence cannot replace human, but yes, it can help human if it is used wisely. So with that understanding, probably we should be using AI in our practice, and it has a very means unlimited role. Whatever you think of doing, AI will help you in a better way. But for patient care, probably, and for the betterment of the patient, it is the human touch and the feel and the emotions which are needed for the healing of the disease. That cannot be replaced by AI, and we have to take care of that. And if we are working sensibly and taking care of these aspects in the use of AI, probably we will be a better doctor and will be able to provide a better patient care. And obviously, it will be beneficial to the patients also. Thank you very much.
Congratulations, Dr. Pai. This is a very interesting topic, AI in medical practice. And this raises the thought, is it going to be a friend or competitor or enemy for medical practitioners? I believe that we should take it as a friend, but the limitations with AI would be, as the data pool increases, the information which it provides will be better. Like all septuagenarian doctors, what their experience is. So AI is over a period of time, when we feed in the data, we'll get better results. And there'll be limitation also, there'll be a lot of ethical concerns. But what I feel, AI will never compete with humans in medical practice, but it will be a great complementary tool to us. Like Sir has talked, that if we have to prepare a talk or a presentation, but whatever it gives is very, mechanical. You have to improve it, you have to add your knowledge, only then it will be a complete presentation. So it will be a good assistance to us, but I believe it will not be able to master the human mind, the human emotions, and the human expertise. But of course, we have to use it, and it's going to be really be a great boon in clinical analysis and giving us better results in our practice. Thank you.
Thank you, Dr. Pai, for this wonderful lecture. My journey with AI, I think, also started last year when Mr. Barlia gave his lecture. And I was a skeptic, and my question was that if all of us start using AI, when will we use our intuitive power, our analysis? And I think his answer impressed me, and I'm now a convert. And what he said that many years ago, the calculator came. And people said that, we'll stop multiplying, we'll stop dividing. But the calculator actually helped us. And then came the computer, the Google. So it's really, these are devices, and it depends on you how you use it to get the optimum benefit out of it. Definitely, for me, it helps in analysis of data. It helps in concising papers and giving me the short synopsis. It gives me a quick Google analysis. Google, there'll be different outputs for the same topic. But yes, you have to correct it, you have to check it. For example, in PCOD, it's still following the Rotterdam criteria when we know we've moved on. So it's a tool that needs to be used wisely, but it's an extremely useful tool. And the second thing which I want to agree with Dr. Pai is we have to have ethnic specific data. Until we have that, all the tools and algorithms for your dosages or frozen embryo transfer that are being built all over the world should be used in Southeast Asian patients with caution. It cannot be just translated into our patients, and we need caution in that. Thank you very much.
Congratulations, Dr. Pai. It was such a wonderful talk, and it's always lovely listening to you. And I want to congratulate the Walter Bushnell team to bring us all together here. The only thing, Dr. Pai, that worried me was if we have, voiced deliveries, then where will we all go? Just see the huge number here. I think it doesn't, I wish and pray that never happens. But the way AI is progressing, nothing looks like impossible today. But no doubt, as you pointed out, there are so many goods to it. And I think we all can take the good out of it. Prediction of preterm, prediction of preeclampsia. Definitely, it's such a blessing for our patients. But on the same side, I feel AI to predict the, as you said, the good oocytes and the bad oocytes. But we know these are all, whatever the AI is going to tell, it's just too much on the exterior. There is much more depth to the ova, which might look not so good, but and we all know it has given us a pregnancy. So at the same time, I feel, will we need studies in future to, have an evidence of predictivity of the AI tools we're going to use? Maybe, because just latching onto it 100%, I don't think would be the right thing. Definitely our own interpretation, the human mind, the capacity is, I think, beyond the AI. We have to be more alert, keeping all the gray cells functional, because we cannot be fooled by AI. That's, I think, we must remember. Take it, analyze it, and use it, and still don't stop using our own gray matter. Thank you.
One comment I wanted to make is that the big problem that guys like me are facing, because I'm an application guy, I like to buy equipment, buy programs and apply them, is the selection of the program. Because the problem is that huge amount of programs are available. Which one to buy? Which is the right program? That's the big challenge. And the second thing I feel when I look at there's a new machine that has come, automatic vitrification. You just takes the eggs and just does the vitrification. But what if there's a short circuit and the machine stops? So that's one of the big things that differentiates humans is a negative feedback mechanism. The humans have a huge, suppose I'm picking my hand, he says stop, I'll stop my hand. but if I give that command to the machine will still may go forward a little. That negative feedback mechanism is the differentiator, I feel. The humans have that, very powerful, the sixth sense, which of course is maybe AI only, but is that very powerful, that sixth sense which we have evolved. Is, I think machine will take still some time to reach that sixth sense level. And of course the limitation is the chips that are there, the silicon. It has a lot of other implications, climate change, blah blah blah. So it's not, there's a lot of downside as well as we go on to the machine. Thank you.